knows what Prechop is, or who doesn't know what Prechop means? Do you know what Prechop is? Most of you probably do know what it is, but let's just think a little bit, okay? What is phaco after all? Phaco is like this bird wanting to eat this fish in one go, or like you wanting to eat that big cake outside. Phaco, all it is cutting the cake into small slices and swallowing it. I took a picture of this bird, half an hour later he still couldn't swallow the fish. He was greedy, he wanted to eat it, but he couldn't because he didn't have a phaco. Right? So, if you think about phaco in that sense, all we're trying to do is to reduce the size of the nucleus into small pieces so that the cataract can be removed through a small incision like that, and the lens going in through that same small incision. Here again you can see the main incision, how well sealed it is through this on OCT. Of course you can remove the cataracts through a small manual, small incision cataract surgery. You get the whole nucleus out, but that's not small enough. We really want to have 2.4 or 2.7 millimeter incisions. And as we heard from Sri, there are many techniques. But divide and conquer, stop and chop, direct chop. Professor Chi after me is going to tell you about the rich person's way of doing a pre-chop. Okay? And Professor Chi is a very wealthy surgeon, so she can afford that. I'm a poor surgeon, so I will do the poor man's pre-chop. Okay? So as you can see from there, that's exactly what Sri showed us earlier. So what is phaco pre-chop? This is from a femtosecond laser pre-chop, but a pre-chop, a standard pre-chop, is the dividing of the whole nucleus into 4 or more segments without using ultrasound to do the division, no grooving, and then no femtosecond laser energy usage. Okay, and you know the advantage of a phaco pre-chop is that there's complete separation of the nucleus quadrants, which is very easy. With flags, as you will see when Prof. Chi tells you about it, the laser cracks the nucleus into 4 or 6 fragments, but it's incomplete. There's still a base plate at the bottom that's not cracked because you have to leave a safety margin from the posterior capsule. And you always need to complete that. And phaco pre-chop, of course, is cheaper and simpler. And phaco a pre-chop was an innovation by our friend Dr. Takayuki Akahoshi in Japan. And he's such a quick surgeon, he takes 2 minutes a case, 60 cases in the morning, 5,000 cases a year. And that's how quick he is. I mean, most of us don't have that sort of volume and don't need to operate that quickly. But it's interesting, he taught us pre-chop 20 years ago. It was an innovation both in technique and in instrumentation. And he came to Singapore 20 years ago and taught us pre-chop. And many of us tried it and all of us failed. You know, we're all reasonable surgeons, but we all couldn't do pre-chop properly. Why? When I look back at it, I understand why. Because at that point enough, he didn't communicate well enough with us that the need for patient selection and the choice of appropriate procedure, whether you did a karate pre-chop or a counter pre-chop, and the teachings of the skill perhaps wasn't done as well as it could be. But now there is a resurgence of pre-chop because having done flags as well, I use pre-chop for my flags nuclei because it's incompletely cracked. I put a pre-chopper in to complete the crack. And after that, you get the feel of pre-chop. Then I brought it back to standard phaco surgery, and I found that it's actually a very good technique. So when we think of manual pre-chop, there's two. One is the karate pre-chop, where you can do this for softer cataracts up to maybe 1.5 plus nuclear density, and for denser ones, 2 plus or above, you need a counter pre-chop. In other words, you need something to support the nucleus before you crack it into the segments, and you use that for denser cataracts. So the principle of the karate pre-chop, and I think certainly at your level, I think counter pre-chop is probably going to be a little bit difficult, but karate pre-chop is actually very straightforward, and I think that many of you can learn to do this simple technique. And the principle is to push the pre-chopper into the heart of the nucleus, open it, and then crack it into 2 halves, rotate 90 degrees, then pre-chop the halves into quadrants. And that's how you get the 4 pieces. And here let's have a look at one. I'm using the Combo 2 pre-chopper, which is a very good pre-chopper that Akahoshi designed years ago. This is a softish cataract, it's probably 1 to 2 plus. Now the important thing is after good hydrodissection, I put OVD to show the nucleus. Here's the combo 2 pre-chopper going in, pushing it into the nucleus, halved. So the nucleus has been halved, and then you use that to rotate. That's why hydrodissection is important. You want to be able to rotate this nucleus 90 degrees, and then we'll do the second division. Proximal half is done, distal half is done. So that's 4 quadrants in 30 seconds with no expensive femtosecond laser. I told you I'm a poor surgeon, right? So then what you do is you can put the splitter into the left hand just to ensure that you've got complete division. And nowadays when I've got a good division, I don't even bother that. Most times I don't even have a splitter or a chopper in my left hand, and I do single-handed phaco of the nuclear quadrants, as you can see here. And most of the time you will find that if you're doing this type of pre-chopping, your CDE, your dispersed energy, is very, very low, and usually well under 5 as such. So let's look at another one. Okay. Now here's another one. Now it's important to make a good size capsulorhexis, because when you're rotating or you're chopping the subincisional, you don't want to catch the edge of the rhexis, which you can do if you're not careful. But having done the good CCC, you want to do a good hydrodissection, and then the OVD is very important to push the cortex away so that the face of the nucleus is exposed. Here's the combo 2 again going in, pushing in. This was actually quite nice. You can see this is actually almost a 2+. Nucleus, rotate 90 degrees and crack it, and it works very well. Okay, and once you've got it into 4 pieces like this, you don't really need to put in a splitter in the other hand, and you can go ahead and do the phaco. As you can see here, just go straight ahead, impale that quadrant, and go to memory 2 where the vacuum is high, so you can pull the nuclear fragment out. You can see here it's a little bit sticky here, but eventually it will come out. You just need to get the grip, and then the fragment will come. Okay, here's another case. Again, OVD in. This is a older patient, and this is a new pre-chopper. Okay, this is now a combo 4 pre-chopper that Akahoshi just introduced 3 months ago in ASCRS. And I told you earlier, with the combo 2, you can only go up to 1.5, maximum 2+. Here is more like a 2+, 2 to 3+ nucleus in an older patient, and you can see this cracked it very, very effectively. Okay, so the combo 2 pre-chop is safer for soft nuclei, what I call the neither here nor there nuclei. I think tomorrow or on Saturday, Panet's going to talk to us about soft cataracts, and I think that direct karate pre-chopping is actually one of the very nice techniques for doing this. So actually this is the combo 4, that was the combo. This is the new combo 4, you can see it's much thinner. A much thinner one, and this is an 85-year-old lady with probably a 3+ nucleus, and you can see that this new pre-chopper actually is able to crack 2 to 3+ nuclei very, very well as well. So that was the first cut, here's the second, and here's the third, and you can crack it into 4 very, very easily. And I would say today about probably 80% of all my patients get a pre-chop like this up to 3+ nucleus, and it works really, really well. Here, let me show you the difference between the combo 2 and the combo 4 pre-chopper. Here's the original combo 2 pre-chopper, which is still a very good instrument, but only up to 1.5 or 2+ at most. Here's the newer combo 4, and when I turn it on its side, you will see that there's a bevel here, and it's made much thinner and sharper to enable it to penetrate the denser nuclei more efficiently. Here you see the difference. Here is the combo 4, here is the combo 2. Much slimmer and more tapered at the tip. It's really a very, very effective. There you go, how sharp that is compared to the old one. Again, this is an 80-year-old patient with a 3+ nucleus, goes straight in, cracks into half without using any phaco energy at all. And now sometimes if you cannot rotate the nucleus or you're worried about hitting the subincisional CCC, nothing to stop you putting a is fitted in and just rotating the eye. But that's where the hydrodissection is very, very important, and then you just go back in and complete your 4 quadrants with this. You can of course crack this into 6 pieces if you want, but 4 is usually adequate for most cases. So with a combo 4 pre-chopping, you can go up to 3+ nuclear sclerosis with care. It's much sharper, but because it's sharper, you also got to be more careful you don't touch the edge of the capsulorhexis. One of the main challenges in doing a successful karate pre-chop: assessment of the nuclear density. So in clinic, I will always write down 1+, 2+, or 3+. So I know myself in the OR which chopper, which pre-chopper I'm going to use. Good size CCC, good hydrodissection, easy nucleus rotation, and again, complete separation of the nucleus. But you have to be aware of complications. If you are trying to do a 3 to 4+ nucleus and you use the combo 2, because you forgot what I've said, and you push into it, what's going to happen? You're going to break zonials, aren't you? So when you start, choose those soft, 1+ nuclei. Those are very, very good. And as I've said, sub-incisional radial tears may be caused if you're not careful. Okay, especially when rotating or pre-chopping the proximal half of the nucleus. Now there are other uses of pre-chop. Okay, what happens if you've got a small pupil like this? When you've got a small pupil like this, it's going to be hard to groove because you can't get a long enough groove to crack. So this is one of those situations in which I think that the pre-chopping is actually quite a useful technique. But even for this, I think it's not a bad idea to stretch the pupil. And here you see me using 2 Kuglen hooks, just stretching the pupil in one direction first. And this of course breaks a few sphincter muscles, but it saves us having the expense of using a Malyugin ring or iris retractors. And so we stretch it in one direction, then the other direction, and then you can rely on the OVD to just dilate the pupil up a little bit more to allow you to proceed with the capsulorhexis and the surgery. So here with the OVD going in, you can see the pupil's a little bit better. Just now it was perhaps 3, now it's 4 to 5 millimeters. That's doable. But again, even with a standard stop and chop and a softish cataract, it's going to be hard to get a nice deep tunnel to get everything done effectively. So here we're just doing a CCC. Let's move that on a little bit more. And here we're going to do the pre-chop. And again, because the pupil is small, it's very nice to be able to pre-chop it like this, because I know that the crack in almost every case extends out to the peripheral nucleus, and I don't have to worry about incomplete nuclear separation. Again, so that was the first crack, and here's the second and third cracks done. Now you can imagine if you didn't have a cracked nuclear fragment, you would struggle a little bit trying to groove and remove the nuclear fragments in a case that's soft like this and with the pupil the size it is. And you can see that once that first quadrant has come out like that, the rest of the operation is really pretty straightforward because the 4 quadrants are free and loose. Okay, let's move on. What about this? The pre-chopper can also help us get out of trouble. This is one of my colleagues and this is just a 1+ nucleus, and I said, pre-chop this. She said, no, I don't really feel confident doing a pre-chop. I want to do my normal stop and chop technique. So here she is trying to do a stop and chop. And when you try to stop and chop a soft cataract, you're going to groove. And here's the grooving going on. But when you come to crack the soft nucleus, what's going to happen? When you push the 2 nuclear fragments apart, you will see that it doesn't really crack very easily because there's just no resistance to pushing. Let's see if I can move this on a little bit more. Okay, so here she is. She's about to try cracking it now. And with these soft ones, you need to be very deep, otherwise it won't crack. And here she's trying. Now that's not a nice feeling. Huh? When you've got a soft cataract, you're trying to push it apart, it doesn't. So what do most people do? Well, that doesn't crack, so let's rotate it and try somewhere else. So that's what she does. She tries to make it deeper, goes somewhere else, and then she's rotated it a bit now, trying to get it deeper to crack, and still it won't crack. There you go, she's trying again, another time. Ah, that got a little bit. Okay, and then she tries to remove it, but because it's not free in the other quadrants, it just will not come. So when it's become like this, what do? So at some stage she decides she's had enough and says, would I take over and help her finish this case that's, you know, now you've got a bit of a crater there, and it's a little bit like what Sri showed just now, with a bit of crater, but then you've got nothing to grip, very hard to proceed with this, so she comes back and says, here, you do it instead. And so I go in and I have a look and say, oh gee, okay, that's not a nice situation. Soft cataract, big bowl in the middle, nothing very recognizable in here. And I thought, well, maybe I'll just use the pre-chopper and see if it can just help me complete the cracking. So I put in the pre-chopper, just get enough nucleus there to do a pre-chop there. And remember, she had another little chop there. So that was enough, just by doing that, to free up that fragment enough that I could then go back in and pull that nuclear fragment out. See, I didn't need to do very much. So I come back out, and then just bring the phaco tip in, and because that's free and there was a bit of a crack there, then you go to memory 2 and you just grab the edge of the nuclear fragment and you can pull it out. There. And so once you've got one fragment out, then the rest is straightforward. So I think that the pre-chop can help in that small pupil. It can also help get you out of trouble in some of these in which there's a partially cracked, softish nucleus. So I think I'll just stop pre-chop here. I think the counter pre-chop is a little bit too complex. We'll leave that for another day. Thank you very much. And now I'd like to ask Soon Pik to come and tell us about the rich person's way of pre-chop.
The rich person, what is that?